Hello guys, so now we shall be discussing the most important high yield points in case of lower limb. Okay, so when it comes to the lower limb, you know this is the lower limb. Lower limb starts all the way from the anterior superior iliac spine. Okay, so this is your anterior superior iliac spine over here, right? And this is your pubic tubercle. So joining both of them, there is a ligament called as inguinal ligament. So from here, the lower limb starts. So this is the thigh part, and this is your knee, and this is your leg. Okay, so there are three important parts. So first of all, let us make the section of the thigh. So this is the section of the thigh which you can see. Now in this section of the thigh, few important things you need to keep in mind is that there are three important compartments over here. So what are the three important compartments? See here, this one over here is called as an anterior compartment. Okay, this one over here is called as a posterior compartment, and this one over here is called as a medial compartment. So there are three compartments. One is called as the anterior compartment, posterior compartment, and medial compartment. Okay, so what is the nerve of anterior compartment? It means what is the nerve that supplies your entire anterior compartment? That is your femoral nerve. Femoral nerve. And after that, the nerve that supplies the entire posterior compartment is sciatic nerve. Sciatic nerve. In the same way, the medial compartment is the obturator nerve. So there are three important nerves over here. One is called as the femoral nerve, sciatic nerve, as well as the obturator nerve. Okay. So when it comes to the anterior compartment, there are two actions that are done over here. Either there will be flexion of the hip or there will be extension of the knee. So let us discuss what are the flexors of the knee. So flexors of the knee are divided into two groups. One muscle which is straight is called as rectus, which is present in the femoral region is called as femoris, rectus femoris. Second important muscle is called as a vastus muscle. Okay, so how many vastus muscles are there? There are three important vastus muscles. Okay, so what are those three important vastus muscles? One is called as vastus lateralis. Okay, another one is called as vastus intermedius, and the third one is called as vastus medialis. So there are three important vastus muscles: vastus lateralis, intermedius, as well as medialis. Okay, and next we have got the rectus femoris. Now coming to the extension of the knee. So within the extensors of the knee also there are three important extensors. One is called as a sartorius, right, and the other one is called as a pectineus, and the third important one is called as a psoas. So you know psoas is of two types. One is called as psoas major, another one is called as psoas minor. So these are the muscles over here. Important thing to remember is that sartorius originates from the anterior superior iliac spine. So this is your sartorius muscle. So what are the few important things that you can tell about sartorius is that sartorius is a S-shaped muscle. Okay. Second important thing, this is the longest muscle, and it is also called as Taylor's muscle and honeymoon muscle. Now this is a very important question, that what action makes it to be called as a honeymoon muscle? There is flexion, abduction, and external rotation of the knee, right? So there is flexion, abduction, as well as external rotation. So this is the reason why it is called as a honeymoon muscle. Second important thing is, this is the thing, coming to the rectus femoris and the vastus muscles. What do you mean by rectus? Rectus is straight, femoris is in the femoral region. So this muscle is called rectus femoris. Okay, so these two muscles here are called as rectus femoris. So rectus femoris originates from, all of you see here, this part is called as anterior superior iliac spine, whereas this is called as anterior inferior iliac spine. Now you tell me, rectus femoris originates from anterior inferior iliac spine. Next, what is this? This is the muscle that is present laterally, so vastus lateralis, present medially, so vastus medialis, and which is in the center here like this. This is called vastus intermedius. So how many muscles in total? One is called as rectus femoris. Next we have got vastus lateralis, vastus medialis, and vastus intermedius. So how many? 4. So all these 4 muscles together, you see here 1, 2, 3, 4. 4 muscles together you called as quadriceps femoris. Okay. Why? Because all these 4 muscles together, they have a common tendon, and that tendon is called as quadriceps tendon. And this tendon, as it passes over the patella, you should call this as patellar ligament. And patellar ligament inserts here, this is called as tibial tuberosity. Tibial tuberosity. Okay. Next important thing is the medial compartment. So all the muscles of the medial compartment are pulling the thigh medially like this. That is why they are all called as adductors. So what are the muscles over here? The first important muscle is pectineus. Why it is called pectineus? Because here we have got a line called pectineal line. So this muscle attaches to the pectineal line, so you call it as pectineus. Next, compare this muscle, let us say muscle number 2, 3, right, and 4. 2, 3 and 4. Tell me, out of these three important muscles, which muscle is short? 2 is short. Okay, compare 2 and 3, which is short? 2 is short. And comparison with the 2, 3 is bit longer. So which is short is called brevis, which is long is called longus. So this is called as adductor brevis, this is called adductor longus. But look at 4. 4 is not long, but 4 is vast, right? 4 is large. That is why he called as adductor magnus. Adductor magnus. And you see there is a very thin string like muscle that is attached all the way to the leg over here. So this is called as a gracilis. So overall, we have got how many muscles? One is called as a pectineus. Another one is called as a adductor brevis. Next we have got is the adductor longus. Next we have got is the adductor magnus. And the third important thing over here is gracilis. So these are the important muscles over here. Okay. Next important thing over here is that if you look here, anterior compartment, posterior compartment, medial compartment. As I already told you, we have got only 3 compartments, right? So in this picture, you can see I have already discussed. We have got 3 compartments: anterior compartment, posterior, and medial compartment. So remember this thing, that all the muscles of anterior compartment, right, are called as flexors over here. So the important thing over here is that in the anterior compartment, you have got flexion as well as extension, both actions. So in the anterior compartment, flexion is done by what? Flexion is done by the hip, whereas extension is done by the knee. So when it comes to the posterior compartment, it is completely reverse. Flexion is done by the knee and extension is done by the hip. But when it comes to the medial compartment muscles are only one group, that is called as adductors. Adductors. Okay, right. The most important topic here we'll discuss is the femoral triangle. So if you can see here, you can see a triangle here, right? So this particular triangle over here, which you can observe here, this is called as femoral triangle. Okay. Now in this femoral triangle, what are the important things we have got? So first, if you can figure out, this is called as anterior superior iliac spine, and this one over here is called as pubic tubercle. So between anterior superior iliac spine and pubic tubercle, this green color ligament which you have over here is called as inguinal ligament. Inguinal ligament. Okay. Now here, lateral and medial, you know, this is the medial side, this is the lateral side. Laterally, we have got a muscle that starts all the way from anterior superior iliac spine, and I have already discussed it. That is called as your sartorius. Okay. Next, medially also we have got a muscle over here, and that is called as adductor longus. What is that muscle? That is adductor longus. So if I ask you what are the borders of femoral triangle, what will you tell? It has got a lateral border, it has got a medial border, and it has got a base. Lateral border is having sartorius. Medial border is having adductor longus. See, this is the lateral border, this is the medial border, and this is the base. Okay, base is having what? Inguinal ligament. All these three together form a triangle called as femoral triangle. Now within the femoral triangle, most laterally, see, we have got 3 important things: NAV. N stands for nerve, artery, and vein. So the nerve which we have over here is called as femoral nerve. Femoral nerve. The artery which we have over here is called as femoral artery, and next the vein is called as femoral vein. Okay. Now, but femoral artery and femoral vein, both of them are enclosed in a sheath. This particular sheath is called as femoral sheath. So what is the structure that is present outside the femoral sheath? That is a femoral nerve. Okay. Right. Now after this, let us go little more detail. What we will do is that we will remove this femoral sheath and put it down over here. This is a femoral sheath. Now within this femoral sheath, if you are dividing it into 3 compartments, so this will be the medial most compartment, this is the center, that is the intermediate compartment, and this is the lateral compartment. Okay, lateral compartment. Now, in the lateral compartment, what do you have? You have got this artery called as femoral artery. Intermediate compartment, you have got femoral vein, femoral artery as well as femoral vein. Next, if you look at the nerves also, where is the femoral nerve located? This is not the femoral nerve here. Femoral nerve is this one. Why? As I already have shown you here, femoral nerve is located outside the femoral sheath. So here also femoral nerve is located outside the femoral sheath. Now inside the femoral sheath, here you have got a branch over here. This is called as genitofemoral nerve. Genitofemoral nerve. Genitofemoral nerve divides into two branches. One is called as genital branch, okay, and other one is called as femoral branch. Genital branch and femoral branch. Now what is to do with this femoral branch? This femoral branch passes down all the way along with the femoral artery. So if I ask you from lateral to medial, what are the structures that are located? One is your femoral nerve. Next you have got is a femoral branch of genitofemoral nerve. Next you have got is the femoral artery. Next femoral vein. And medial most you have got lymph nodes over here. These lymph nodes are called as lymph nodes of Rosenmuller. Lymph nodes of Rosenmuller or lymph nodes of Cloquet. Rosenmuller or lymph nodes of Cloquet. So this is all you need to know about the femoral triangle. Now let us discuss about the posterior compartment. In the posterior compartment, we have got the gluteal region back of the thigh. Back of the thigh muscles are called as the hamstring muscles. Coming to the gluteal region, we have got 8 different kinds of muscles here. The first 3 are very easy: maximus, medius, minimus. And after that, the remaining you have to remember it as top question. What is top question? T stands for tensor fascia lata. Next, obturatus internus, piriformis, quadratus femoris, and the last one is gemellus. Two types of gemellus, superior and inferior. They both look similar to each other. That is why they are called as twin muscles. Out of all these, medius, minimus, and tensor fascia lata are called as trio muscles. Okay. Next important action you can see over here is that in the hip we have got two important actions. One is called lateral rotation of hip and medial rotation of hip. Lateral is lops. Remember like that. Lateral is lops. L stands for lateral rotation. O stands for obturatus internus. P stands for piriformis, and S stands for superior and inferior gemelli. Coming to medial rotators. In the medial, what are the first 3 letters? MED. MEDI. MEDI in the sense MEDI here also, that is medius. After medius, we have got minimus. Okay, these two do the medial rotation of the hip. Now, when it comes to the nerve supply, you can see all the way it ranges from the lower limb, nerve supply all the way ranges from L2 to S3. So, the root value of L2, L3, L4, together they form two important nerves. One is called femoral nerve, another one is called as obturator nerve. You already know from the first picture of the topic, femoral nerve is an anterior compartment and obturator nerve supplies the medial compartment. Now, this is the anterior side and this is the posterior side. Now coming to the posterior side, you see from L4, L5, S1, S2 and S3 nerve roots, you have got a very thick nerve that has come out. This thick nerve over here is called as sciatic nerve. Sciatic nerve. Okay. Now this sciatic nerve gives out a branch and this branch is called as common peroneal nerve. This is called as common peroneal nerve. So if you look at common peroneal nerve is dividing into two. One is lying just beneath the skin, I mean superficially, one is lying deep. So this is called as superficial peroneal. One is called as superficial peroneal and the other one is called as deep peroneal, superficial peroneal and deep peroneal. Now, if the deep peroneal nerve is damaged, that is what it leads to food drop. Whenever a patient is having food drop, this would result in high steppage gait. Okay, this is one of the very important thing. Second important thing you can see over here is that apart from this common peroneal nerve, this sciatic nerve continues down as tibial nerve. This is your tibial nerve, right? So tibial nerve is the nerve that supplies to your hamstring muscles, that are the muscles that are located on the back of your thigh. Now that continues downward. The tibial nerve continues downward as posterior tibial nerve. Posterior tibial nerve. So posterior tibial nerve supplies to your calf muscles. It supplies to your calf muscles. For example, if there is injury to this posterior tibial nerve, that would lead to a condition called as tarsal tunnel syndrome. What is that? That is tarsal tunnel syndrome. So tarsal tunnel syndrome will lead to a deformity that is called as clawfoot deformity. Clawfoot deformity. Clawfoot deformity, right? The toes, the particular toes which you see here are called as hammered toes. Okay. So I'll show you the picture here. So these are the toes. You see, these toes are called as a hammered toes, where you see the clawfoot deformity in this. Coming to the back of the thigh, as I already told you, back of the thigh muscles are hamstring muscles. Remember it by the mnemonic MyTap. M here stands for what? M here stands for semimembranosus. T stands for semitendinosus. A stands for posterior part of adductor magnus, and B here stands for biceps femoris. Okay, so these are the muscles which you can see. Coming to the muscles of the leg, very important. So in the leg, how many compartments do we have? We have got an anterior compartment, we have got a posterior compartment, we have got a lateral compartment. We don't have medial compartment in the leg. Okay. Now in the anterior compartment, there are artery, vein and nerve. What is the artery that is located here? Artery located in front of tibia. See, this is your tibia bone, this is your fibula bone. Artery located in front of tibia is called anterior tibial artery. Vein is called anterior tibial vein, and the nerve is called deep peroneal nerve. Next, the artery located back of the tibia over here, right, you can see, is called as a posterior tibial artery. Vein here you called as a posterior tibial vein, and the nerve is called tibial nerve. Okay. Now, and in the same compartment on the posterior side only, you have got PAPV. PAPV in the sense peroneal artery and peroneal vein. So peroneal artery and peroneal vein gives branches to the lateral compartment. You see, they are giving branches to the lateral compartment. So in the lateral compartment, do you have a nerve? Yes. What is the name of the nerve? SPN. SPN stands for superficial peroneal nerve. Along with superficial peroneal nerve, do you have artery? No. Do you have a vein? No. So lateral compartment is not having an artery and vein by itself. Then from where it is receiving this blood supply? It is receiving from the posterior compartment through this peroneal artery and peroneal vein. Now in the posterior compartment, right? So this is your anterior compartment. Okay, this is your lateral compartment, and this is your posterior. In the posterior, you see there are two compartments again. So in the posterior, you see there are two compartments again. See, this particular one is called as a posterior superficial compartment. This particular one is called as a posterior deep compartment. How many compartments? Two. Posterior superficial and posterior deep. Now in the posterior superficial, do you have any artery, vein and nerve? No. So posterior superficial compartment is devoid of neurovascular bundle. It does not have any artery, vein and nerve by itself. Then from where it is receiving the supply? It is receiving the supply from the posterior deep compartment. How? With the help of posterior tibial artery, tibial vein and tibial nerve. Right. So this is the thing I was telling you, that the posterior superficial compartment, right, is not having any neurovascular bundle by itself. Okay. This was a question that was asked in the recent AIMS. Okay. So here this is what I was telling you, that the posterior compartment is superficial and deep. Superficial has got no neurovascular bundles on its own, and it receives the neurovascular bundles from the deep compartment. So there is no medial compartment in the leg. This is the thing which I already told you. So in the leg, what we have is the anterior compartment, lateral compartment and posterior compartment. So if I am putting my leg in this way, this is the anterior compartment, this is the lateral compartment and this is the posterior compartment. So what is the use of this anterior compartment? When I am pulling the muscles here, the anterior compartment, the leg is raising in this way, right? You see the leg raises in this way. Now you can raise the leg like this, right? In this way. So this is called dorsiflexion. You see there is a flexion on the dorsal side. This is called dorsiflexion. Okay. Now coming to the posterior compartment, you can even put your leg in this way. This is called plantar flexion. So if you look at the leg in this way, right? So if this is the leg over here, right? So here, this is the dorsal side of the leg, this is the plantar. So if the muscles I'm contracting here, there is dorsiflexion. If I'm contracting the muscles here, there is plantar flexion. And what is the use of the lateral muscles here? All of you can look here. This is the lateral compartment. So I can levate the leg like this. So these are called levators. Okay. So there are three important compartments with three important functions. Anterior is dorsiflexion, lateral is levation, and posterior is plantar flexion. Coming to the anterior compartment, you have got tibialis anterior. So these are the muscles: extensor hallucis longus, extensor digitorum, peroneus tertius. Okay. Coming to the lateral compartment, brevis and longus we have got. Posterior compartment, we have got two, as I told you. Posterior is divided into superficial and deep. Superficial, remember the mnemonic GOSIP. G stands for gastrocnemius, soleus and plantaris. Okay. Here, the anterior compartment opposite is the deep posterior compartment. Okay. For example, here if there is tibialis anterior, here there will be tibialis posterior. Here if there is extensor hallucis longus, here there will be flexor hallucis longus. Here if there is extensor digitorum longus, there will be flexor digitorum longus. Okay. The important thing you need to know here is that gastrocnemius has got two heads, lateral head and medial head. Soleus is one head. So totally how many? Three. These three heads together are called as triceps suri. Okay. Triceps suri. Next important thing which you have got is that, see, this is what is called as gastrocnemius. What did I tell you? Gastrocnemius has got this is called as a lateral head, this is called as a medial head. Okay, and behind this gastrocnemius, you see this muscle, this one, this muscle over here is called as your soleus. So gastrocnemius and soleus together, they have got a common tendon. Okay, or they have got a common tendon like this, and this particular common tendon attaches to the calcaneus, and this is called as your Achilles tendon. So in the next picture, I will show you the Achilles tendon over here. You see, so there are two muscles, that is, two heads of a muscle called as gastrocnemius, and this blue color one in the center is called as your soleus. Together they have got an Achilles tendon which is responsible for ankle reflex. The root value is S1. Coming to the popliteal fossa, this is one of the interesting topic that has been asked all the time by the examiners over here. So coming to the popliteal fossa, what are the important things you can see over here? In the popliteal fossa, first of all, there are four important muscles which we can see here. See, this is called as biceps femoris. Okay, biceps femoris. This is called as semimembranosus. Membranosus. Here itself we have got semitendinosus also, which I cannot show it to you here. Tendinosus also, which I cannot show it to you here. And next we have got the gastrocnemius with the lateral as well as the medial head. So if you look at the borders over here, right? So if I'm dividing the thigh, if I divide in the popliteal region like this, right? Now the top, so if I'm putting a line also like this, okay, let me use another color. So if I'm dividing it like this, I'm putting a line over here. So if I ask you which is a superior, the top one is called as the superior. Superiorly, we have got two important things. See, this is lateral side, this is medial side. So superior laterally, what do we have? Biceps femoris. Superior medially, what do we have? We have got semimembranosus, semitendinosus. See, superior medially, we have got semimembranosus, tendinosus. Laterally, we have got biceps femoris. In the same way, inferior laterally is this, inferior medially is this. Inferior laterally, we have got the lateral head of gastrocnemius, medially we have got the medial head of gastrocnemius. So this is the important thing which you need to know over here. Now after this, what is the next important thing which you need to know? What are the contents? Now coming to the contents, you see this green color branch which is passing here. This is called as your popliteal artery. If there is popliteal artery, there is popliteal vein. Next, you can see two important nerves. One is A, one is B. A is called as a tibial nerve, B is called as a common peroneal nerve. So these are the four important structures that are form the contents of the popliteal fossa. Okay, so this is all you need to know regarding the lower limb, guys.